This disease, obesity, is a very dangerous medical problem that tends to cause a decrease in life expectancy by 10 to 20 years. So it's something that requires treatment, not just as an afterthought in a physician's visit.
Weight is such a central part of someone's health journey that when you address it, when you help it come to a healthier point, you get to see things that go along with the weight get better. So diabetes, blood pressure, sleep apnea, back pains, joint pains, infertilities.
It affects their entire life. How they interact with their kids, it affects how they interact with their coworkers. It affects their health. It affects almost every aspect of their health. So when we're able to affect a major change in the patient's weight, we're making a change in their entire life.
The number on the scale is important, but it's less important than someone's overall health.
I am not a general surgeon. I don't do trauma surgery. I don't do breast surgery. I don't do colon surgery. I do bariatric surgery, and I take care of bariatric patients 100% of the time, and that's what our practice is built on.
So what I try to do is make sure patients realize that they're not just a stomach with feet that walked into my office, that they're a whole person who has a mind, a body, and a spirit that needs attending to in service. We focus on making sure that our patients in their healthcare journey with regards to weight are appreciated, respected, and served.
Our job as bariatric surgeons isn't to cure the disease, but it's to help these patients manage this condition long term and understand that we are here not to judge them, but to help them get through this long term. So if they gain a few pounds, they shouldn't feel bad about coming to see me. They should say, oh, I've gained a few pounds. I need to go see him.
They're not doing this alone. God puts us on this planet in families and part of communities. We need to be part of their community for their health, not just for the short term after surgery, but for the rest of their life.
And when they finally get something that they see works, many of them just grab it so tight, they're just not letting it go. I've got a few patients that are doing ultra marathons, patients that have done ultra Ironman competitions, things that I can't even imagine doing. You know, for these patients to have been downtrodden and felt like they had no control for so long, some of them feel so empowered now. That's really great to see.
I think the most rewarding part of my job is the interaction with the patients, seeing how they interact with their friends and their family after surgery, seeing what they're able to do that they couldn't do before. It's little stories. Someone who's flying on a plane and not having to use an extender. Someone who's getting down the floor with their grandkids and getting back up again. Those are the sort of stories I love to hear.
When you get a chance to impact a patient's life and you get a chance to see that patient for the first time in their office rolled in a wheelchair, and you know that if you do your job right, they're gonna be walking out of here a year from now off of oxygen and not in that wheelchair. You know, that's powerful, that's impactful. That's why I come to work every day.